13 before 9, and we're going to continue with Johnson County today. We have some folks here from Western Missouri Medical Center to visit with me about something they have going on there, and let's just go around the room and find out who we have. Go right ahead.
Good morning. I'm Dr. Lynn Birchmier, and I've worked at Western Missouri Medical Center for 17 years. I am board certified in obstetrics and gynecology.
All right, over here. Well, nice to have you ladies here today to tell me about what you have going on. One thing I've noticed is I've actually read about this a while back. Pellets therapy.
Yes.
Can we start with that? Because I thought that was so interesting when I heard about this.
Okay, yes.
Yeah.
We are doing hormone pellet therapy.
What is that?
That is, well, first of all, let's just start at the beginning and say that all people, men and women equally, start to lose their hormones as they get older.
So this is hormone therapy then?
Yes,
right?
It's hormone therapy. It's
Okay.
given in the sub-Q space of the hip, and it lasts for 4 months at a time. And it's safe. It makes a difference in how you feel. And most people don't realize that they are missing their hormones until they get them back.
True.
Maybe I need to get some of those then, huh?
Maybe you do. You can come see us, and we'll be happy to figure that out for you.
Figure out whether I need those or not, huh?
Yes, because even though we're a women's clinic, what we do there is, except for hormone therapy, treatment of women for obstetrics and gynecology needs throughout all phases of life. But with the pellet therapy, we are also treating men.
Do you have very many men?
Several, yes.
You could use more though, huh?
Always can use more.
Okay. What would be the balance? A lot more women than men, or is it about the same?
Right now, a lot more women than men, not because they need it more, but because we're a women's clinic. I think the word hasn't gotten out that we're treating men for hormone needs as well.
Okay. Some of the services you have in your area at the hospital, there's more than just this one thing, isn't there?
Yes. For women, we provide obstetrical care of normal and high-risk patients. We provide annual examinations for their yearly checkups, birth control consultations, placement of birth control devices, problems with gynecological areas such as abnormal bleeding, surgery for removal of cysts, sterility procedures, hysterectomy, basic medical care for women all the way to complicated surgical care for women.
Dr. Birchmier, how many of you are there and do what you do there?
Well,
Are you it?
No,
Okay.
Not at all. We have 3 physicians there. We have 2 nurse practitioners, and we have 4 certified nurse midwives who provide OB care as well as delivery of obstetrical patients in the hospital under physician guidance.
Okay, now I want to be sure I pronounce your name. Your first name?
Adonis.
Adonis, okay. The I is in there, and I kind of didn't know whether I needed to pronounce that or not. What's your responsibility there?
So I do mostly gynecological care, so I do a lot of annual exams.
Move in on the mic just a little. So, yeah, there you
I
go.
do a lot of annual exams, gynecological problems, so if patients are having any side effects or issues relating to like their birth control or pain, they can come and see me, and then I do the hormone replacement therapy.
What does the NP after your name stand for?
Nurse practitioner.
Nurse practitioner, okay. I kind of knew that, but I thought somebody
Yeah.
else might want to know what
Absolutely.
that meant. And how many people do what you do?
Just me.
Just you?
There are 2 nurse practitioners.
Okay.
Adonis's designation is that she is a women's health nurse practitioner specialist.
Oh, okay. Is it right in the hospital, or is this an office somewhere else?
The office is actually in NS2, which is a building directly behind the hospital.
Oh, that's where you are then?
Yes.
Okay. People need appointments?
Yes.
They can't
ideally
just...
So.
Are you getting a referral from another doctor, or do they get appointments to come see you first?
Oftentimes, referrals aren't necessary, particularly for annual exams, which is considered primary care. But they should check with their insurance about whether they would need referrals to come and see us, or if they just call and make an appointment, we can usually tell them if referral is necessary.
What is the hormone therapy meant to do? What is it to do?
It's meant to provide basically balance. So as Dr. Birchmier said before, as we get older, we lose our ability to produce hormones, or it's less efficient. So when we replace those hormones, we're kind of restoring that hormonal balance so that people feel better, more energetic. It increases their focus. It helps with skin, hair, and nails. It helps with libido. So there's so many things that can be gained when we restore that hormonal balance.
Do men or women lose their hormonal balance quicker?
So,
Or is there a difference?
well, there's a difference in the ratio of hormones from women to men. So specifically for testosterone, once women reach the age of 30, they've lost somewhere around 40% of their testosterone, and then it just steadily declines from there. For men, they say the average is just 1 to 3% per year, and that affects each individual patient differently. So I can have a 30-year-old man who's just tired and dragging, and his testosterone levels might be at one place, and I can have a 45-year-old man whose testosterone levels are lower, but they still feel better than the 30-year-old. So we're really treating the patient and their symptoms more than we're treating hormone levels.
There's no average here, is there? I mean,
No, there's no average.
Everyone's different then.
Exactly.
Okay. I see a word here. I want to find. You have a partnership with
Biote.
Biote?
Yes.
What is that?
They are a hormone replacement company. They specialize in pellet therapy. So they are our partner in that we utilize their materials and their research and their pellets and everything to treat our patients.
Now, I think the question was answered earlier, but I'm going to ask it again here because I didn't quite understand it. How is this administered? Doctor, you want to take that? The pellet therapy?
Sure. We calculate doses based on a lot of factors. Those are individual per patient, and how they feel is one of those factors, as well as sometimes laboratory values and other factors. But the procedure is done by numbing up a spot on the hip where the fat deposits are, just a local anesthetic injection, and then we just make a small nick in the skin through which we place a trocar, which is just a guiding device that we put the pellets through, just like a trough, like your gutter almost, but much smaller. Okay.
Yeah. Okay. Thank you for that.
They go into the fat layer, which is where they're absorbed. The hormones absorb best in fat tissue, so that's where we put them. That is covered with just a little small dressing that you leave in place for 24 hours, and then a steri strip would be underneath that, which is just a little piece of tape that covers the wound. It's completely healed within 3 days. You notice a lot of improvement within 2 weeks following placement.
Just in how you feel.
Yes,
Exactly.
Most people are shocked at
More
how
energy?
much. Yes, how much better they feel.
Yeah.
And then they would follow up with us after that, depending on how long they had been receiving therapy, approximately every 4 months.
Okay, what happens to that pellet? Does it dissolve?
They absorb slowly over time into your bloodstream through
It just goes away then.
through the fat layer. Yes, they go away.
Huh. How long have you been doing this?
4 years.
It's relatively new therapy then?
It's really not.
It's not?
This therapy has been around since the 80s. It's considered to be very safe, and it's considered to be the most effective means that we have to replace someone's hormones.
Yeah. If I would come see you, what would be the first thing we do?
sit down and talk about how you feel and what your symptoms are and what your goals are for your treatment.
Is there a test you can that you would then do to maybe determine where my level was?
We do. We do laboratory testing on everyone after their consultation is performed to see what their levels are and what they're deficient in, and to make sure that their general health is good and that they would qualify for pellet therapy.
Not everybody qualifies?
No, not everyone qualifies. Most people do. And as a man, if you had an elevated PSA, which is a prostate-specific antigen, you would potentially be disqualified from therapy due to that.
Okay, I have had prostate cancer. I would be disqualified.
Potentially, depending on where you are in your treatment, yes.
No, that was years ago, though. It was like 10 years ago or something like that.
Yes. So not necessarily, but
so I could
but you
still
could
qualify for that.
You
okay.
could.
Is it very noticeable to the person who's had this? I mean, they are going to feel a lot better.
It's extremely noticeable.
It is.
Yes.
To the outsider, even somebody looking in.
To the spouse, yes.
The
Yes.
spouse would know.
That's true.
They often tell us that their spouse needs to be seen sooner or needs different kind of treatment, or that they're just doing fantastically better. So yes, the spouse has a better view sometimes than the patient even.
So true.
What do we do from here? Golly, when we've had all this figured out, it's a continuous thing then for the rest of your life, or will that take care of it for a year or two, or is this something you'll have to have done again?
It's a continuous problem, so it's a
It really
continuous
is.
answer to the problem. And I tell patients, as long as this makes a difference in your life and you feel better, then you should continue therapy.
About every 4 months.
Yes.
You
3
come
times
in,
a year.
3 times a year, you could come in and have the little pellet,
And
as
what
you call
we
it, implanted.
what we left out is that therapy for men is usually done every 6 months.
A women is 4
Women is 4, men are 6.
because the women lose their hormones quicker than men do.
Because we implant a higher dose of pellets for men, they absorb more slowly, so they don't have to come back as frequently.
Okay.
And that just doesn't work well for women.
Are you guys busy?
Yes.
But we could be busier.
That's kind of a silly question, I think, but are you busy? I mean, you see somebody every day then, so this is I'm going to use the word problem here. Is it a problem?
It's a definite problem for people's health and also for just general well-being. But like Adonis said, we are busy, but we want to reach out and try to help as many people as we can with their problems. So we work on being as efficient as we can to reach out and be able to have availability to see as many people as need to be seen. So we can grow as far as that's concerned.
Do you need more doctors and nurses involved in this program, or are you pretty well staffed right now?
I think our staffing is good. It will depend on the growth of the program.
Yeah.
So when
You're right now you're trying to grow the program, let more people know that you are there and you have the ability to help.
Absolutely.
You want to add anything here, Adonis?
No, I just want to know when you're coming in for your consultation.
Oh, you're looking forward to that, huh? I think I may be past that now. I'm not sure. Ladies, thanks a lot. Dr. Lynn Birchmier and Adonius Wright, NP,
Thank you.
nurse practitioner.
Thanks for
Listen,
having us.
You're more than welcome. Good luck with this. Sounds like a great program at Western Missouri Medical Center.